pressing record so that we're recording this. And as I said earlier, the webinar is going to be available through our website tomorrow, and we'll be sending the link directly to all of you who have registered, so you'll have first access to that. So the three speakers that we have today are Michael Weimer, who is the president and CEO of the Marfan Foundation, Jim Cavan, the founder and CEO of Backpack Health, and Brett Collinson, who's a senior vice president at Backpack Health. So now what I'm going to do is turn it over to Michael Weimer, who was also referred to as one of the guys in the chat box here. So, oops. Michael, there you go.
I think that's the more handsome of the two guys you just put up there. Let's start with that. Good afternoon, everybody. I really appreciate you joining me today. You know, looking back on all the great accomplishments of the Marfan Foundation, of which there have been many, I really believe the creation of the Marfan Syndrome and Related Conditions International Registry will really be instrumental in changing the course of health for thousands of people that we currently know and some that we have not yet met. For community members and their families, you will be able to manage, organize, and securely share your health information. And that may be in maybe some of the most interesting moments of your life, when that kind of information is absolutely critical, either for treatment or for other purposes. The other wonderful thing about Backpack from my perspective is that you're also going to be able to play an active, think of that, active role in research. And hopefully that will lead to not only new treatments, which happen almost daily in our world today, but also life-saving outcomes for people that we may never even meet. The other thing that I find really exciting is that we are quickly moving into a leadership role in serving members of our community, which was really, you know, my hope from the beginning of this journey. And it really started for me probably the first summer when we had our conference in Chicago, and I met a very senior volunteer, and he was carrying his medical information in a tattered white sheet of paper in his pocket. And he said, if something were to happen to me, hopefully they'll have this sheet of paper and we'll be able to make sure whatever I need happens appropriately. Well, the matter of fact is that now through Backpack, we won't need to carry those tattered sheets of paper or notebooks or try to explain to somebody that may have never heard the word Marfan or a related condition. You'll be able to share your medical records right now in 5 languages, soon to be more, anywhere you may find yourself. If you have a moment where it's important to share that information, it will be available to you. So to me, we are on a journey unlike any journey that we've been on. The success of this journey is really dependent upon the members of our community. For us to be successful, you need to sign up, at which there is no cost. You need to engage, and you need to help to spread the word about Backpack and the Marfan Foundation. To quote a wonderful friend of mine, Jim Cavan, who is the president and CEO of Backpack, we will do something great. Today, you will see the journey to greatness is already underway. Jim?
Thank you, Michael. I'm flattered and proud to be supporting the Marfan Foundation on behalf of Backpack Health. As Michael said, we were inspired by my niece, Maggie, who sits next to me, a young lady thriving with Marfan syndrome, and has been entirely the focus of this vision for me. I'm completely humbled by the team that I get every day to work with, represented here on the call by Brett Collinson and Kate Solaro, and I think Rob Medina from our user support team is here. So at any point, if you have questions, please post them. We'll get to them at the end. Backpack was started as a result of observing how people who care for people with complex health conditions or people who are living with complex health conditions are challenged by information needs, are exhausted by the request to contribute research data, and really just need some truly functional utility to make some aspects of their life easier. That was the spark that we all ran with. And what we've created is a tool that hopefully provides true utility to the families and the patients of those with complex health conditions, allows you to be very much in control of your information, allows you to share it as you need to, allows you to have emergency access, either directly through Backpack or through unique relationships that we have with medical jewelry companies. And that is in 5 languages, as Michael said. We are adding more. We believe that is a critical aspect to providing a good quality of life for people, is to let them interact with us in their native language. The 4 of us on the call are really just the tip of the iceberg. We have a whole team of software engineers and data scientists and software designers and business people and finance people and ethicists and research attorneys who we work with. Backpack is a very robust little project. We are now global, and we were anticipated to be that way right from the start. I'm flattered to say we have users right now in over 30 countries. When we activated the Marfan and Related Disorders International Patient Registry, I was updating the board of directors, I think about 5 days in. And at that point, we had about 17 different countries who had already been represented by people who were registering. So the global reach that Backpack allows the Marfan community and related disorders community was something we really hadn't anticipated. And it's allowed us now to start to really think much bigger picture of how we can reach out and collaboratively and as a supportive community begin to really support and learn from people very far away. And that's very important scientifically. It's also important just humanistically, as what we're here to do is to provide, support. Remember, Backpack is not just for the patient. Backpack is designed to support an entire family. And that's very important if we look at genetic conditions where we want to track and enroll and capture information and support the health needs of people who may be dependent minors, maybe the person is a parent or grandparent. All of that is possible within Backpack, and we will show you all of that. Backpack as a product and Backpack as a company grow and learn by feedback. We need it. We ask for it. We ask for it sincerely. Sometimes that feedback comes back to us very lovingly and supportively. Sometimes it comes back to us very directly as a criticism. All of it's important to us. We mean that we have lots of ways you can reach out to us. I'm virtually an open book on social media, or my contact information is everywhere. Please feel comfortable to reach out to me or any member of my team. We are anxious to hear from you and anxious to hear from your thoughts. So I am honored to work with Brett Collinson. He is an amazing intellect and a man who has empathy and understanding of problems that I am constantly in awe of. So I'm going to turn you over to Brett, and I look forward to answers at the end, questions and answers at the end. Thank you.
Hi, everyone. It's so great to be here, and it's a real privilege and to just take you through what it is to join the registry, how you can use Backpack on any device, and really how you can get value out of it, but at the same time be able to really easily contribute all your information to research into the registry. So that's one of the key ways that Backpack is different from a traditional registry, where you normally just contribute data into the registry and hope that it does good. Backpack is different in, first and foremost, it's a tool to help manage your everyday health. So you can put all of your information into Backpack and then choose what information to share into the registry to make that information powerful. So I'm wanting to take you through all of that today. I know some of you have already joined the registry, so have done some of these steps. I'm going to assume that you've done none of them just so we can see it all, but we'll quickly get into that place where hopefully we can all pick up from where we are and get the most out of Backpack. So I'm going to start by just sharing my screen. So the first thing about joining Backpack is there's a special link that you join Backpack to connect to the Marfan and Related Disorders International Patient Registry. You probably know about that. It's on the Marfan side. You may have seen it in emails and in social media. You can also always get to it from the Backpack Health site. So this is a Backpack Health site, and here's the link here. So you can jump on that at any time and click this link to join. When you go there, you go to a page like this, and if you ever need the URL, but maybe you don't, but it's joinbackpackhealth.com/Marfan Related Disorders Registry. That gives a brief bit of information about the registry and who it's for. You can always follow up with more detailed information there. But if you're ready to join, it's as simple as clicking this join link. I'm actually going to do this in our demo environment just so we can play around together in that. So I've got that loaded over here. So here's the equivalent page in our demo environment, and there's a join button there. So I'm going to join. The first thing I do is I need to sign up and create an account. So this is for me, and the scenario we're going to work through is I'm going to imagine that it's my daughter that I'm actually signing up for in terms of she's the one living with Marfan, but I create an account for me first because I'm the one accessing Backpack Health. So I'm going to type in my email address, a special one for this occasion. And I create a password, just like you do on any other site. Creating accounts is easy as that. And then the first thing I do is I need to set up my profile. Now, one of the questions we get asked is if you're joining the registry for someone else, say your child, is it my information or is it my child's information that I put in? The important thing to remember here is you set up your profile first, and Backpack allows you then to create other profiles for the other people in your life that you care for, including one or more people who you may be living with who have Marfan. So set up your profile first, and then you can easily set up other profiles, and we'll guide you through doing that. Setting up a profile is really quick and easy. You just enter your information, enter your name. We collect your date of birth. Enter your gender. And then finally, we capture where you live. And that's either your country or in the United States, it's your state as well. We do that both for the research value in knowing where people come from in a broad sense, but also there are different rules and regulations in different countries and states, and we want to make sure that knowing where you're from, we can adapt the system to meet those requirements. So that's a really quick way of setting up a profile. And then at this point, you're ready to join the registry. Now, if it was you who were living with Marfan, you would just tick me and click join. But because I'm going to set this up for my daughter, who has Marfan, what I need to do is actually create a profile for her. So yes, it is for someone else I care for. So I just click this link to create a profile for her. And I go through very much the same process. It's collecting the same information. So let me go through that. Let's say her name is Samantha. And I call her Sam, so I'm going to change and you can do that. So the app can sound friendly for her. Let's type in her date of birth. She's female. And she lives with me, so it's made it easy and selected New York by default, but I could change that if she wasn't living in the same place I was. So we now have Sam in the system as well as me, and I'm going to select Sam as the person whose information I'm wanting to connect with the registry for. Now, at this point, if there were multiple people in your family who you're wanting to connect to the registry, do the first one first, and then you can go back through the same process. You don't have to create your account as you did in the first place. When you click that link back on this page to join, it'll automatically step you into this part, and you can add someone else. That's how you join for multiple people. So I'm going to join for Sam. And there's 2 screens we just need to go through to make sure that it's appropriate that we can join for Sam. The first one is just confirming that Sam has one of these conditions that the registry is designed for. And so, yes, that's true. Sam has Marfan syndrome. And then this screen is really important, and I want to linger on this screen for a bit just to make sure we understand it. This is the consent to share information about Sam into the registry. And we're just wanting to make sure that you're really, really clear with what this is all is about. So when you join the Marfan registry on Backpack, it's really important to know that the Marfan Foundation and the registry and the researchers can't automatically see all of the information you put in your backpack. They can only see the information that you explicitly share with them. So you can use Backpack for not just Marfan, but you could use it for your whole family for a variety of different health needs. It's only the information that you explicitly share with the Marfan Foundation through the registry that they can have access to. So that's really important. And I'll show you the mechanisms that you share that information so it's really clear. The other thing that's important to note is you're not opening yourself up to the other members of the registry. You're just opening yourself up and sharing information with the administrators of this registry. And you're also allowing those administrators to contact you through the app at any time, but they don't have direct access to your email address or your contact details. They can only do it through Backpack. So at all times, your privacy and your personal information is kept with you, and it's not shared into the registry. If there are any questions about that, this is really important. So in the Q&A session at the end of this, we can go through those. But if that's okay and I agree to that, I'm going to select OK. And then I've joined Sam, and Sam's now connected to the registry and for the Marfan and related disorders registry. Now, at any time I can get into this information. If I click through here, this is a place where we've got contact details, and you can review that criteria and the consent information, so you can access that at any time. This area is going to grow over time, and this will be a great place for resources that the Marfan Foundation provide that'll be accessible through Backpack Health, and lots of other things. This is really where the registry and the Marfan Foundation connect with you within the Backpack Health app. I'm going to go back, and then we can start to explore this backpack. So first of all, we set up Sam's profile, and that was really just the start of it. You can really personalize this. If you've got a photo, you can add a photo, so that's in there as well. There's more information here that's optional, but some of this is useful in research. So race and ethnicity is something you can add, but you don't have to. If you're not comfortable adding that, you can say you don't want to answer this. But let's say Sam is Asian American, so I'm going to choose Asian and white. So I can choose as many of these if it's a multiracial situation. When I click next, this allows me to actually customize how that ethnicity and race is presented if I was sharing some of this information with, say, a provider. Backpack Health, as we said at the start, is both a robust research tool, so we have our categories down here, but it's also a tool that we can use to just share with people involved in our care. And it's important that you feel really comfortable with the information and how you're presented with that. So for example, if Sam likes to be referred to as Asian American, that can be her self-identified race with that deeper understanding that that's a mixture of Asian and white in this case. So you can sort of see how both of those can fit together and live. That's actually the same thing we do with gender. So, for example, if you were of a gender identity that's not one of these traditional ones, you can also go in there and enter your gender expression, how you see it, so that it's important that you feel confident that when you're sharing that information with a doctor or someone else, they can identify with you as you choose to be identified. Backpack Health always wants to give you that flexibility, so Backpack feels like it's truly yours and you're not having to fit into someone else's categories. You can also enter blood type. That's a useful thing in an emergency situation, for example. So I'm going to enter blood type. And I've started to fill out Sam's profile. Now there's a few more things I can do with Sam's profile. Maybe I want to choose another color. You'll see in a moment how you can have multiple profiles. So a color is a key way of identifying that, because the environment for Sam changes based on her color. So she loves this yellow color, so I'm going to choose that. And then the last thing you can do is maybe it's not just me who looks after Sam. So if I wanted to invite her mum there, I could type in her mum's email address, and then she would get an invite to also share Sam's information. So when she logged into her Backpack, she'd be able to see her information and also the same information that I can see about Sam. So it really allows this co-ownership where if it's a child, for example, multiple parents or step parents can all have access to that information and contribute information into Sam's profile. So everybody's on the same page with the information about Sam. So that's some basic information about setting up around the profile. I want to switch now to the Backpack itself, where we can start to add information. So Backpack is a place where really any health information about Sam can be entered, whether that's her Marfan specific information or any information about her general health. And you do that by adding health entries. So there's this big plus button at any time you can add. And this is sort of the range of different health entries that you can create. So we've got conditions and symptoms, medications, treatments and therapies, procedures and surgeries, the different types of allergies, vaccinations, measurements, and then lab and test results, and then genetic results. So you can go to town and add as many of these as you want. And I'm going to step you through a few just to get the idea of it. Let's start actually with something that some people sort of almost assume, but it's really important to put in there: Sam's actual diagnosis of Marfan. So I'm going to click on condition and symptom. One of the things that when we joined the registry for Sam, Backpack starts to be customized and feel at home for someone living with Marfan or a related disorder. So you can see, for example, that some of these suggestions are the conditions or symptoms or diagnoses that would be relevant for someone with Marfan. So I can see that Marfan is already one here. So I don't even have to search for it. I can just select it from this list. But if there was something that you wanted to add that wasn't in this list, you can at any time just search for it. And you're literally searching across millions of different health terms in lots of different ways, whether they're everyday health terms or clinical terms. You should be able to find the thing you're wanting to add, so that really Backpack can be that comprehensive place where everything about your health is in one place. I'm going to choose Marfan syndrome. And a key bit of information about a condition or a diagnosis like this is if it's been confirmed or suspected. So I can click into here, and in this case, it's confirmed. And I can't recall right now exactly when it was, but I know it was back in 2015. So we don't want you making up dates that aren't true and you don't know. So Backpack is flexible in that if you only know a month and a year, you can enter that. If you just know the year, you can enter that. Or if you know exactly what it was, perhaps because you're looking at some medical records, you can enter the exact date. But just enter what you know. So 2005, I'm going to add that. And that gets me started with a key bit of information in my Backpack around Marfan syndrome. So I'm going to click done, and now my Backpack has that diagnosis. The next thing I want to add is an echocardiogram. So this is a medical record that I have, and that was a procedure in surgery. So I'm going to click that. Now here, when I look through the list, I can't see it directly. So I'm going to start searching. So I'm going to type in echocardiogram and do a search. And you can see it's come back, and I can click that and select it and start to enter that information. I roughly know that this was back in September last year. Now for this one, I have some of the things you can add to these health entries. You can add a note at any time. So if you just want to put in a comment that relates to this, you could easily add a note to this. In this case, I actually have a file, and the file's over here. And it's something that, you know, it could have been, oops, wrong one. That's going to come later. It's this one here. This is one that was on a patient portal, but there wasn't an easy way for me to download it. But I just took a screenshot of it, and that's just another way of getting information. But if you're accessing information on patient portals, sometimes you can download a PDF, or there are other ways of accessing that. Or maybe you've just taken a photo of a medical report that you have. Whatever way you can get access to that file, you can upload it into Backpack. So I'm going to attach that file. And in this case, I'm going to attach it from my computer. And here's my desktop, and here's that echocardiogram. And I'm going to click OK. And I'm going to I can change its name just to make sure it's clear. This date is actually, if I know the date from when this was, it's useful to change that date. So I can actually see on here that it was the February 22nd of 2016. So I'm going to go in there and change that to be February 22nd, 2015, 16, go OK, and click OK. And that'll now upload that into my Backpack. I can see it there. And when I go OK, it's now a file that's attached to this echocardiogram, which is really great. It's all sort of organized for me. You'll see I could flip over to this file section in my Backpack, and there's the file. So I could always just grab that at any time if I was just looking through files, or if I was looking through the health entries in my Backpack, if I go into that one, I can see that it's attached there, and I could click on it there to view it from there as well. So whether I go in from health entries or just looking through my files, I can see it. The next one, I'm going to add a medication. So I'm going to click medication. And again, we've got a lot of the common medications for Marfan or related disorder in here. So I'm going to choose this one here. And Sam's currently taking it. She started it back in September. Now I'm going to enter in how much and how often. It allows me to start to put in some details about the dosage. So I'm going to put in 50 milligrams and once a day. If you didn't know any of that information, you don't have to enter it. Backpack is flexible, and we'd love you to put as much information as you can, both because it's useful for you and it's also useful to contribute into the registry. But if you don't know information, either at the time you're entering it or at all, just enter the information you know. So I've now entered a medication. The last thing I want to enter is something new. It's not currently in the app, but it's coming real soon, like in the next couple of weeks. And that is genetic results. So if we say that Sam's actually been genetically tested and we know she has an FBN1 mutation, we can enter that information into Backpack, which is useful to have as a record, but it's also useful as the information that's contributed into the registry. So I'm going to click genetic result. Again, these genes that are listed here have been tailored for Marfan, so I'm going to click FBN1. And I know, for example, that there is a variation, and it was, that will actually show a list of the different classifications. So it was pathogenic, so I'd be able to choose that, and I click OK. And the other thing I can do is add a file. I should note about these files, one of the benefits of joining the Marfan registry on Backpack is normally files and file storage are part of the paid Backpack account. But by joining the registry, the Marfan Foundation is paying for the special paid subscription of Backpack that allows you to store files. And in a moment, I'll show you translation. So it's just one of the benefits of joining the registry, that the foundation has covered the cost of a pro account, the paid version of Backpack, as opposed to the free version of Backpack that has limited functionality. So I've got this genetic report, so I'm going to add that because that's a useful thing to include as part of this genetic record. And click OK and click Done. And now I've added that as detail for this genetic report. So we've started to see, and we've filled up the Backpack with some of the information. I want to now turn to how we can make that useful in sharing that out with people involved in Sam's Care, but also into the registry. So to do that, we flip over to the share card area. Now, sharing information that's stored digitally in the cloud can often be scary, and you often have anxiety around who exactly can see my information and what information can they see. As I said, we want Backpack to be the place where you store all of your information, and we want to make sure that you're confident that if you share information for particular situations, only the information that will be relevant is shared in that case. So we've created these share cards, and they're places where you can specify and curate what information is shared in what situations. Now, we load up Backpack with an emergency card because that's useful for everybody to have. And we also have a health history card, which tells a fuller story of someone's health, which you may want to share with, say, a provider or someone who wants to have that fuller picture of someone's health. I'm going to start with the emergency card. So this is where, for information in an emergency situation, I can load up that card with those key details. And to do that, I just click on that edit button down here, and I can go through each of the categories and choose what I want on this card. So I definitely want that Sam's Marfan syndrome is on that card, so I can click there. There's a comment field at the bottom, so if there's additional information that isn't categorized in that area, I can add that to the card as free text. And that starts to curate the information that's on Sam's emergency card. Now, it's great that it's in Backpack, but in an emergency situation, maybe the person that needs this information can't access Backpack because they can't get it into your phone or something like that. So we've added to Backpack on each of these share cards, you can enable a unique URL. So this URL, it's a short URL, so it's easy for someone to type. It's unique to this card. Every card has a different URL. So this card with the access code could be something you could put on the emergency lock screen of a phone, or a medical bracelet, or on a card in your wallet. It's a great place for someone, if they're looking for that key information in an emergency situation, to have access to that information that's on your card. So that's something you can do with an emergency card. You can do with it's a good way of sharing information on all of your cards. I want to flip over to health history. You'll notice that all of the information that we added to Backpack is we've conveniently added it to the health history card. But if there's some information that you don't want to put on that health history card because of who you're sharing it with, again, you can always jump in here and remove that information. So say, for example, for whatever reason, I didn't want to include that medication, I could turn that off, and then it's no longer on that card. So I can feel confident that just the information I can see on this card is what's going to be shared. So I could turn that URL, another URL for this card, and that would be a great way of sharing with a provider, for example, and they would always have up-to-date information. I could also add those files. So I could jump in here, and if I wanted to share those files that I've got in my Backpack with a provider or someone else, that's a great way of giving them access to some of the deeper information that's in Backpack. The other thing you can do with share cards is you can just produce a PDF of those. So if you want to just give someone a one-off snapshot of what's on that card, Backpack will produce a PDF, and you'll be able to download that and then just share that out or print it out and to hand it to someone. It's another way of giving access to the information on a card. And then finally, the great thing about share cards is our translation, which is another bonus feature that you get for free that normally is paid for, but is provided by joining the registry, and the Marfan Foundation give you complimentary access to that. So if you're in another country, or if you're wanting to share that information with someone that doesn't speak English in this case, you can easily choose another language and the card will instantly flip so that all of that information is in that language. So that's great. And if you shared that URL with someone and they were viewing that not in your native language, they would be able to flip the information as well. So that rounds out what you can do with Backpack for SAM. I just wanted to highlight again that if I go up to this menu here, I could jump back to my original profile that I set up when I created this account, and I could use this to capture my health. But if there are other members of my family, I could come in here and create profiles for them, just like I did for Sam. So this could fill out to be all profiles for all of the people I care about. While we're on this menu, I want to point out, as Jim mentioned, we love feedback. We do a new version of Backpack about once a month. A lot of the new features that are in there is direct response to the feedback and the suggestions we get. So at any time, you can jump in here and go to the Help Center, and you can either send an email, oops, wrong one, not to the Help Center, actually, to jump back into here. Contact us. Help Center is great too. If you're looking for how to do things, jump into the Health Center. You'll see a lot of articles about how all of this works. What I meant to show you is Contact Us. If I click here, you can either send an email directly to help@backpackhealth.com, or if you choose Chat with Us, it'll open up this live chat session where you can just chat to us, and Rob and Kate are on the end of that, and they will respond to you within the app. So you can get sort of direct feedback and contact there. Last thing I want to mention is I've shown you all of this on the website, and you can certainly access Backpack on any browser at any time, so you can always get to it. Backpack Health is also an iPhone app and a smartphone app for Android. So you can go to either the App Store or the Play Store and download it to search for Backpack Health, and then log in with your login details, and you'll see exactly the same thing on your smartphone. You can also get to those links if you go back to the Backpack Health site. At the bottom of every page, there are links there directly into the App Store and the Play Store. So you can easily get access to the Backpack app. One of the really nifty things about the Backpack app is that not only is the information stored in the cloud, but we store all of your information securely encrypted on your phone in the app. So if you're ever without a data connection on your phone, you'll still be able to get access to all of your information, and even flip it into other languages. So you're never without your information wherever you are, even if you don't have an internet connection, if you're using our apps. I just want to cover one more thing just before we go. And one thing I missed, which is back in share cards, if I flip over there, is a special share card that you'll notice is added when you join the registry. This is the special Marfan and related disorders registry card. This is how you contribute information into the registry. So any information you put on this card, and we put a lot of the information that you entered by default, but again, you can choose to edit this and take that information away. This is the information, and only the information, that goes into the registry. And you'll notice when you go into this that we have protections for your personal information, that you cannot share your name. You can only share your year of birth, not your date of birth. You can't share your photo. So these are some of the protections so that the information you share is de-identified. Your identity is never known to researchers, but it's how you can contribute all of the information that's relevant into the registry to really make that information that you have in your backpack powerful for research. So I'm going to stop there, and we would love to answer any questions that you may have.
So we do have some questions here, Brett. So it says, are you working on allowing some very popular patient portals automatically syncing things like meds and files?
Yeah, that is a great question, and it's something we hear lots, and it's something we are actively exploring. So as we see at the moment with Backpack, you have to add your information, and hopefully you can see it's fairly easy to do that. We know that some of that information, and increasingly patient portals are opening up to allow patients to pull down that information either as PDFs or in directly computer readable formats. So we're exploring options to be able to do that, and that will allow you to sync up your patient portals directly into Backpack. So stay tuned for that with something we're prototyping and we would love to get working.
And a question again about the emergency contact. So you talked about the share card, but maybe you want to just go over that briefly again.
Yeah, that's a great question too. At the moment, the way if you're wanting to add emergency contacts is, you know, in the emergency card and in all share cards, there was that additional text area. You can just type directly emergency contacts into that area and then it'll be on that emergency card. One of the things we're doing later in this year is having an explicit contact and providers section within Backpack, almost like a little medical address book in your Backpack where your current and previous providers can be entered there as contacts, but also emergency contacts. And then it'll be easy to just directly add those to your share cards. And in this case, the emergency contact that you've got in your Backpack.
One question that I just wanted to just bring up again is when people want to subscribe, they subscribe first on a desktop computer or like that, and then they can download the app. Can you just go over that again, please?
Yeah. It's best to follow that link that's, you know, on the Marfan side, it's on our side, it's in emails to join. As soon as you've got your account going, you can then swap over to the smartphone app. So, that's where you can just type in your email address and password, and then you can just carry on adding things. And you can swap back and forth. As soon as you add something in one, like on the iPhone app, it'll appear on the web and vice versa. It could be, for example, that you have lots of files just on your desktop computer. So maybe logging in on your browser on your desktop is a great way to add those files. If you've got files in cloud storage like iCloud, or you can, or for example, on Google Drive on Android, you can access those cloud storage files from the smartphone apps as well.
I just want to let Cornelia know that we are recording this webinar and that will be available on our website, and we'll send you the link. Don't want to miss that question. Brett, you mentioned partnering with medical jewelry. So what about, I know you have something with one company, but what about if you have a different company like Kimberly has Medical Art?
Yeah, that's a great question. So we will have integrated partners, so that Sticky J is our first one. And on the emergency share card, there'll be a place to, if you connect with them, or if you have an existing piece of medical jewelry that you have that, you can kind of register it. Mm-hmm. If it's not one of our partners, you can always take that URL that's that you've enabled on the share card and have it engraved on a piece of new jewelry. That's a way of sort of giving people access to that deeper information that's in Backpack. But it'll be through the partners that we bring on. If you've got an existing piece of jewelry, that you'll be able to essentially register those existing pieces of jewelry if they have some sort of identifying number on them that connects it into Backpack.
So Andre, thank you for that. So Andre says the iPhone app is great. Are there any plans for a native iPad app?
Yes, we are going to make Backpack Health work with larger screens. You'll notice if you use it on a really big desktop site that it's probably not taking up, it looks more like a large mobile device. We're going to make sure that on both larger web browsers, but also larger Android tablets and iPad, that it fills the screen in an appropriate way so you're getting the best out of the real estate on your device.
That sounds great. You look very excited by that question. So.
We've been wanting to do that for a while, and it's on our roadmap, and so we're excited to know that people would find that useful.
Great. Somebody who is anonymous wants to know, how does Backpack differ from other medical bracelet sites that allow one to include individual information? Is the only difference contributing to Marfan research?
That's one of the differentiations, but often, you know, those medical bracelet companies, and sometimes they have some sort of electronic record, they're really geared around just emergency information. We want Backpack to be a place where you can store the full breadth of information, both the clinical information that you've got from your doctor, but increasingly you will be able to just have day-to-day health information, like yes, I took this medication today, or other more of the lived experience stuff that, you know, wouldn't fit in some of those medical emergency type tools. So we think of the emergency information that you have in Backpack as often that secondary level of information that is more than can fit on a bracelet, that's more than can fit on the lock screen of your phone, that someone can access in a secondary way to really fill out that picture. One of the other things we're building is we know that for Marfan and a related disorder and a lot of rare diseases and conditions, sometimes emergency workers aren't aware of those conditions and don't know of the key information and key procedures that and key knowledge that needs to be taken care of and things that need to be ruled out before you can safely send someone home. So that's something we'll be adding so that information from the Marfan Foundation will be added to the emergency share card of people that have joined the registry.
You know, I also love the other applications for the share cards, like, you know, having one for the school and the school nurse and not having to repeat all that information, which, like you said, is not medical information, but it's what that school nurse needs to know. And, you know, the traveling applications or other caregivers, grandparents or step-parents, I mean, that's different from what else I've seen elsewhere.
Yeah.
Can I add a couple? I think one of the biggest things, and to be honest, we've talked to virtually all of the medical jewelry companies, is one, Backpack Health is not designed to be a static snapshot. In those instances, you have to make an extra point to go in and update the information that's stored if they do have an electronic offering. Backpack's not like that because Backpack reflects in its emergency card the most up-to-date information that you or your caregiver has put in Backpack. The other really important thing is Backpack is multilingual, truly multilingual. So if you're using that access card, that electronic tool in another country, or if perhaps you don't speak English and you live in the United States, then you can take advantage of the fact that we can leverage on our presently 5, but soon to be 7, and there, so on and so on, languages, which I can tell you from someone who used to be in emergency medicine is a really nice thing to have if you're somewhere. So thank you.
Thank you, Jim.
Eileen, just to add on also to the
Sure.
share card, it's something I didn't show, but it's important to note that you can create as many share cards as you like. So not just the ones I showed you, but anytime there's a plus button on that screen, just click that, spin up another share card. Maybe, like you said, Eileen, like maybe there's information you want to send to the school, but again, it's not everything. And so tailor the information on each share card to be just the information that's relevant, just the information that you're comfortable with, even though your Backpack contains everything.
Great, thank you so much. Here's another question that maybe this will excite you also, Brett. Maybe you're working on this one. Does Backpack Health offer reminders for taking medication? I mean, that you're working on, or you have that already?
We don't have that already, but it's something that we want to add. We want Backpack to be relevant in your day-to-day life. So reminders are a great way to make Backpack useful in the day-to-day. So that's something we're actively looking at as well. And that really fits into a category of things we'll be adding, which are reminders and what we've kind of internally called trackables. Those things that you just wanting to keep track of on a daily, weekly, whatever frequency basis. Will make it really easy for you to just go into Backpack and kind of just tap one button to kind of say, yes, that's happened again, or yes, I've done that thing that I'm wanting to keep track of as a way of capturing what's happening in the day-to-day.
Great. All right. Thank you so much. I have some other comments, but are there any more questions before we move on? I think somebody just asked a question here. Scroll down and take a look. Oh, there are a couple of more questions. So how do you add other medical conditions? What if you have Marfan and you also have other things? That's great. Yeah.
So that list of suggestions for someone that's joined the registry is just tailored towards common conditions for Marfan and related disorders. But above that, those suggestions is a search bar. There are literally millions of terms in our database. So you add as many different conditions as you want. That way Backpack really reflects everything that's going on in your life, not just in your Marfan life, but in maybe some other conditions you're living with. So feel free, whether that's conditions or treatments or medications, the whole range of things, you should be able to add everything that you're wanting that relates to your health through Backpack.
And what about the other languages that you talked about? What's next? Somebody asked about Russian. You mentioned there are a couple more in process.
We've got, for this year, we've got Italian and Dutch as our next languages. But we're very open as we get feedback from our community about the languages that would be useful. So let us know.
Okay, Russian. There's a vote for Russian right
yes,
there.
I see that.
Okay. Okay, let's see. Anybody else asking questions here?
There's one more in there.
Okay, so here's another one. So if you have, you have your emergency share card and you're in an emergency, how does somebody access it, or do you have to do that? If you're in a car accident, what happens?
So if you're not able to open up your phone and get access to that, that's one of the reasons why we enabled and created those individual URLs on each share card. So the idea there is put that URL anywhere where an emergency responder would see it, whether that's on your wallet card. Most smartphones, both iPhone and Android now, have a medical ID lock screen, so that if you press the emergency button on one of those locked phones, it'll display key medical information. It's like an emergency bracelet for your phone in some ways. You can put that URL there as well, so someone would be able to see that and just quickly type that into their phone or their tablet and get access to that information without having to log into your account. You've provided it through that URL, but it's just the information that's on that card. They can't see everything in your backpack, just the information on your emergency card.
Great. That's really great. All right, so let me move on here. Okay, 1 second. So, I know we answered a lot of questions here. There's more information, as Brett mentioned, not only on the Backpack website, but also on the Marfan Foundation website. If you go to our homepage and you can click on the link right there. And you can also look in the resources and answers for patients and families. There's a section on healthcare management tool, and that will take you to Backpack information. And then on the Marfan blog, there are frequently asked questions. Some of them you guys have actually hit on today. There's a lot more there. You also can, general questions can go, as always, to our Help and Resource Center, and you'll get Jan, our nurse, at support@marfan.org. And as Brett mentioned, technical questions and any other questions you have about Backpack, they're happy to answer also. And there is their URL for that, which he mentioned too. So we will be sending you a link to this so that you can rewatch it, and we'll have a lot more opportunity for you to learn more about Backpack. And hopefully you will you take advantage of this great opportunity and subscribe. And you'll be able to do that now. Do any other panelists have any parting words?
Thank you all very much. It is an honor to work with everyone. Marfan Foundation is just a tremendous partner for us. To reiterate what Brett said, we love feedback. Send us your thoughts and comments, and we will take them all seriously. So thank you all very much.
Great. All right. Well, thank everybody for participating, and thank you to our panelists. Great partnership and doing great things for our community. So thank you and good night.
Thanks so much.
Bye-bye.
Bye-bye.